Hello, and thank you for joining us for Methodist Healthcare's Breast Cancer Series. This series will provide you with the tools to empower you to take control of your breast health. And we're joined today by surgical oncologist Dr. Alfredo Santillan, and we'll be discussing surgical options for breast cancer treatment. Dr. Santillan, thank you so much for being here and joining us today.
My pleasure.
Now, we know each woman's breast cancer journey is different, but could you tell us the surgical options for treating breast cancer?
Absolutely. Nowadays we have excellent options for all women with breast cancer. And we can, in a very basic way, divide it in two types of options. Those who pretty much are tailored to preserve the breast, and that's called breast conservation surgery. And the whole idea is to preserve the breast, skin, nipple, areola, the whole breast, and just remove the cancer with a normal rim of tissue around. The other option would be a mastectomy, and there are many types of mastectomy nowadays, but in general the options are great, and we tailor according to the age of the patient, the type of tumor, and also what they want, but they always have those two options.
Okay. Now, if cancer is removed completely during surgery, does that patient need to continue with treatment?
Yes, absolutely. So the treatment of breast cancer is not only surgery. I would say surgery helps a lot, but it's really a multidisciplinary approach. We have, in a very basic way, 4 types of treatment for breast cancer, and surgery is almost always the first treatment. So, for instance, if a patient has breast conservation surgery, to lower the risk of the cancer coming back because we preserve the breast, we have to offer radiation therapy. So absolutely, surgery alone may not be enough for some of the patients. You know, if we want to really cure, we have to use adjuvant therapy in the form of hormonal therapy, radiation therapy, or chemotherapy.
Okay, very interesting and good information there. Now, there has been a lot of discussion in our culture about preventative mastectomy surgery. What are your thoughts on that?
Yes, it's actually a very good question because it's something that we live every day in the clinic. Many women have breast cancer and they don't know it is related to it. They were born with a gene that was predisposed. 10 to 15% of all breast cancers are gene related. And so if they have known they would have a gene, they could have surgery years before and they will have prevented it. Those patients with a strong family history of breast cancer now have a way to find out if they are, at risk or gene carriers, and there's a very easy blood test that can be done. And in those patients, we can do preventive surgery. And it's actually very important. It's a high success rate, about 90% of success rate, and also combined with very good plastic surgery. So when you combine good plastic surgery with mastectomy, we can prevent cancer in these patients.
Amazing. All right. Well, thank you, Dr. Santillan, for joining us and helping us to really understand more about our breast health. And remember, early detection saves lives. We challenge you to schedule your annual screening. Just go to makeyourmammo.com to schedule your mammogram today.